Have you ever found yourself in this situation? A seemingly routine health checkup. You feel healthy, eating well, moving around normally, and your blood pressure and blood sugar are stable. But then, the doctor looks at the test results and says, your kidney function is showing signs of decline. We often think about our kidneys when we experience swelling, reduced urine output, or high blood pressure. But in reality, the kidneys are the most vulnerable organs that do not speak up. They silently work day and night to filter the blood, eliminate toxins, and maintain electrolyte balance. But because they do so quietly, they are easily forgotten until the damage is too severe. What's even scarier is this. Some of the pills you are taking daily, believing they are helping you feel better, are actually the reason your kidneys are weakening over time. It could be the painkillers you use whenever you feel aches and pains. It could be the antibiotic you take when you catch a cold. It could be the stomach medication, blood pressure pills, or even those prescribed by your own doctor. I am not saying these medications are bad, because when used correctly, medications are life-saving tools. But when used incorrectly, without monitoring, or without understanding their impact on the kidneys, they can become silent killers. With over 10 years of experience in healthcare and advising thousands of patients with kidney failure, I have witnessed too many cases where, if detected early, simply adjusting how medications were used could have prevented the need for dialysis, kidney transplants, or enduring prolonged fatigue. Today, I want to share with you 7 common medications that can have a serious impact on your kidneys, along with simple but extremely effective prevention method. If you or someone close to you are taking medications for blood pressure, diabetes, joint pain, stomach issue, or undergoing cancer treatment, please pay close attention to this content. Don't wait until your kidneys speak up. By then, it might be too late. Antibiotics, not always harmless. Many people believe antibiotics are germ killers, only serving to destroy harmful bacteria, so they think they are safe to use. But in reality, some antibiotics, especially the aminoglycoside class such as gentamicin, tobramycin, or amikacin, can become silent attackers on kidney cells. Why can antibiotics harm the kidneys? When you take medicine, everything must pass through your kidneys to be filtered and eliminated from your body. However, the aminoglycoside group, strong antibiotics often used in cases of severe infections, tends to accumulate in the kidney tubule cell. When accumulation reaches a certain level, it causes degeneration, killing cells, damaging the tubules, and leading to acute kidney failure. Furthermore, antibiotics can cause a condition called acute interstitial nephritis. This is an inflammatory response that occurs in the tissue between the kidney tubules, often due to allergic reactions or toxicity from the medication. What's dangerous is that this inflammatory process occurs silently, with no specific symptoms, no pain, no fever, no swelling, until lab tests show a significant decline in kidney filtration function. People who are more vulnerable to kidney damage from antibiotics include the elderly, particularly those over 65 years old, as their kidney function naturally declines with age. Those with pre-existing chronic kidney disease are at higher risk due to their kidneys' already compromised ability to filter waste. Individuals using multiple medications simultaneously, polypharmacy, also face a greater risk, as drug interactions can exacerbate kidney damage. Dehydrated individuals, those with low blood pressure, or heart failure patients are more vulnerable because reduced blood flow can further strain kidney function. Finally, people who require high-dose, long-term antibiotic treatment, especially in hospital settings, are at increased risk due to prolonged exposure to potentially nephrotoxic drugs. Expert advice to protect your kidneys when using antibiotic. Never buy or use antibiotics on your own. In many places in the world, antibiotic misuse is very common. Many people rush to the pharmacy to buy antibiotics when they have a fever, cough, or cold. This not only increases the risk of antibiotic resistance, but also causes long-term kidney damage. If your doctor prescribes an aminoglycoside antibiotic, It is essential to ask a few key questions to ensure that you are using the medication safely. First, inquire about the duration of the treatment. Knowing how long you will be taking the antibiotic helps to assess potential risks associated with prolonged use. Long-term use of aminoglycosides can increase the risk of kidney damage. So understanding the treatment timeline is critical. Second, ask your doctor if you will need to monitor your kidney function during the treatment. Aminoglycosides are known to be nephrotoxic, meaning they can harm the kidneys. So regular monitoring of kidney health is crucial to detect any early signs of damage. Blood tests to track creatinine and urea levels are common ways to assess kidney function. Third, you should inquire if the aminoglycoside can be replaced with a safer alternative. Since aminoglycosides are potent antibiotics with a higher risk of kidney toxicity, asking for alternative medications with a lower risk is a reasonable approach, especially if you have pre-existing kidney issues or are on long-term antibiotic therapy. If you are undergoing extended antibiotic treatment, particularly in a hospital setting, it is important to request regular blood tests to monitor key markers like creatinine and urea, which help evaluate kidney filtration function. Additionally, if you experience any symptoms such as fatigue, reduced urination, swelling, or lower back pain, report these signs to your doctor immediately, as they could be early indicators of kidney damage, allowing for prompt intervention. Drink plenty of water throughout the course of antibiotic treatment. Water helps dilute the medication in your bloodstream and supports the kidneys in efficiently eliminating toxins. 2. Non-steroidal anti-inflammatory or NSAIDs. After antibiotics, another familiar group of drugs is silently causing kidney damage every day without most people noticing. Non-steroidal anti-inflammatory drugs or NSAIDs. Are you using ibuprofen, diclofenac, naproxen, or meloxicam to relieve pain, reduce fever, or fight inflammation? Most of us, from young people with headaches, adults with back pain, to the elderly with arthritis, have used these medications, sometimes continuously for weeks or even months. The problem is, if you are using NSAIDs frequently, it's time to stop and think carefully. How do NSAIDs affect the kidneys? The mechanism of damage caused by these drugs is quite specific. To understand this better, you need to know that the kidneys require a stable blood supply to maintain their ability to filter toxins and regulate blood pressure. The blood flow to the kidneys is regulated by intermediaries, especially prostaglandins, a type of substance that helps dilate blood vessels in the kidneys, ensuring sufficient blood flow. NSAIDs work by inhibiting the enzyme cyclooxygenase or COX, which reduces the production of prostaglandins. As a result, the blood vessels in the kidneys constrict, reducing the blood flow to the glomeruli, decreasing filtration pressure, and leading to kidney cell damage. In healthy individuals, using NSAIDs for a few days rarely causes serious issue. However, in those who are dehydrated, taking diuretic, or have underlying cardiovascular diseases, high blood pressure, or diabetes, the risks are much higher. In these cases, NSAIDs can cause acute kidney failure after just a few days of use. Dangerous symptoms often overlooked. What's concerning is that kidney damage from NSAIDs doesn't cause pain and has no clear symptoms in the early stages. You won't feel anything until you experience decreased urine output, dark-colored urine, fatigue, loss of appetite, or mild leg swelling. Alternatively, you might accidentally discover an elevated creatinine level in routine blood tests. Once damage has occurred, restoring kidney function is not always easy, especially if you continue using the drug without realizing the cause. Certain individuals need to be especially cautious when using NSAID. This includes the elderly over 60 years old, people using diuretics or blood pressure medications like ACE inhibitors or ARBs, people with liver disease, heart disease, diabetes, or high blood pressure, and those who engage in heavy physical labor, sweat a lot, and take painkillers. Athletes or people involved in high-intensity sports are also at higher risk. To protect the kidneys while using NSAIDs, expert advice suggests only using them when absolutely necessary and according to your doctor's guidance. Never misuse them to quickly relieve pain, especially in chronic conditions like back pain or arthritis. It's important to avoid using NSAIDs continuously for more than 5 to 7 days without medical indications. Additionally, drinking enough water daily, an average of 5. 2 liters is crucial when taking NSAIDs, as it helps maintain blood flow to the kidneys. If you are also using diuretics, cardiovascular medications, or have chronic kidney disease, be sure to inform your doctor so they can consider prescribing a less harmful painkiller, such as paracetamol. Lastly, regularly testing your blood to monitor kidney function is essential, especially if you must use NSAIDs long-term or frequently. 3. Diuretics. You may be taking diuretics every day to manage your blood pressure, reduce swelling, or assist in treating heart failure. And indeed, diuretics can be very effective when used properly. However, what few people realize is that this seemingly protective drug can actually dehydrate the kidneys and gradually weaken them over time if not carefully monitored. The mechanism of benefit and harm of diuretics on the kidneys. Diuretics work by stimulating the kidneys to excrete more salt and water from the body through urine. As a result, blood pressure is lowered, the heart is relieved of some strain, and symptoms like swelling in the legs and water retention are improved. However, when the body loses too much water, particularly in hot weather, excessive sweating, or inadequate water intake, the blood supply to the kidneys also decreases. The kidneys, thirsty for water, will no longer be able to filter blood effectively, leading to a gradual decline in function. What's dangerous here is that this condition often has no initial symptoms. You may continue to go about your daily activities and urinate normally, but only blood tests will reveal elevated creatinine levels and decreased glomerular filtration rate, eGFR. Electrolyte imbalance, a double burden on the kidneys. Not only do diuretics cause dehydration, but some diuretics, such as furosemide and hydrochlorothiazide, also affect the balance of electrolytes, essential minerals that help cells function normally. A low potassium level hypokalemia can lead to muscle weakness and arrhythmias, making the heart's rhythm irregular. Low magnesium levels can cause cramps and irregular heart rhythms as well, which may worsen the risk of cardiovascular issues. An imbalance in calcium levels can increase the risk of kidney stones and nerve conduction disorders, further complicating health problems. When these electrolytes are disturbed, the kidneys must work hard to correct the imbalance. However, if the condition persists, the kidneys will become exhausted, their filtration function will gradually decline, and the risk of chronic kidney disease will increase, especially in the elderly, those with underlying conditions, or those on long-term medication. Who is most likely to experience side effects from diuretics? The elderly over 60 years old are at a higher risk due to age-related changes in kidney function and electrolyte balance. People with low blood pressure, weak heart function, or heart failure are more vulnerable because diuretics can further lower blood pressure and strain the heart. Those on a strict salt-free diet or who drink little water may also be at risk, as diuretics can worsen dehydration and cause electrolyte imbalances. Individuals taking multiple medications, polypharmacy, are more likely to experience interactions between medications that affect kidney function. Additionally, people with a history of kidney stones, dehydration, or electrolyte imbalances should use diuretics with caution. Expert advice on using diuretics correctly to protect the kidneys includes: never increase your diuretic dose on your own, even if you notice more swelling or elevated blood pressure. Any dosage adjustments should always be made under your doctor's supervision. It's important to drink enough water daily when on diuretics, but avoid overhydrating if your doctor has restricted fluid intake. Regular tests to check your electrolytes: sodium, potassium, magnesium, calcium, and kidney function are crucial, especially if you're using diuretics long-term. Aim for at least every 3-6 months. If you experience fatigue, cramps, a racing heart, or dizziness, inform your doctor, as these could be signs of electrolyte imbalance. Lastly, if you're taking multiple medications for conditions such as heart disease, diabetes, or blood pressure, Ask your doctor to check for interactions and their potential effects on kidney function. 4. Antacids PPIs. Do you often suffer from stomach pain, acid reflux, or heartburn? If so, you're probably familiar with names like omeprazole, esomeprazole, pantoprazole. These drugs belong to the class of proton pump inhibitors, or PPIs, which are commonly prescribed to reduce stomach acid, protect the mucus lining, and make you feel more comfortable. But did you know that these seemingly harmless pills can silently damage your kidneys if used improperly over an extended period? PPIs, good effects, but only when used for the right duration. PPIs work by inhibiting the proton pump in the stomach, significantly reducing acid secretion. As a result, people suffering from ulcer, gastroesophageal reflux disease or GERD, or gastritis feel relief, improved digestion, and increased appetite. However, the issue is that PPIs should only be used for short periods, typically from 2 to 8 weeks. Unfortunately, many people, even some doctors, prescribe them for months or even years without reassessing the real need. And that's when the side effects begin to appear. Quietly and dangerously, why do PPIs harm the kidneys? This harm doesn't come from common side effects like nausea or dizziness, but rather from immune system reactions in the body. Specifically, some people who use PPIs long-term may develop an immune response that leads to inflammation of the kidney's interstitial tissue, known as acute interstitial nephritis. In this condition, immune cells attack the kidney tissue, causing swelling and inflammation, which reduces the kidney's ability to filter blood. The frightening part is that patients don't experience clear symptoms. There is no pain, no fever, no decreased urination, until blood tests show a sharp increase in creatinine levels, indicating significant kidney damage. And if not detected early, this can lead to chronic inflammation, eventually resulting in chronic kidney disease that cannot be reversed. Other side effects of long-term PPI use include a range of health risks. One significant issue is low magnesium hypomagnesemia, which can increase the risk of arrhythmias, muscle weakness, and cramps. PPIs also contribute to an increased risk of fractures, as they affect calcium absorption, potentially leading to osteoporosis and higher susceptibility to bone fractures. Additionally, the use of PPIs can increase the risk of digestive infections. By suppressing stomach acid, PPIs allow bacteria to grow more easily, which can lead to diarrhea and prolonged digestive problems. Are you using PPIs incorrectly without knowing? Some people may think, I only take 1 pill a day, so it's not a problem. But this is not the case. PPIs are not vitamins, and they should not be used indefinitely for prevention. People who take these drugs for months or even years without regular checkups or dosage adjustments may be unknowingly putting themselves at risk of chronic kidney damage and other health issues. Expert advice on the proper use of PPIs to protect your kidneys includes using PPIs only as prescribed and for the necessary duration. It's important to regularly reevaluate the need for long-term use with your healthcare provider. Regular checkups are essential when using PPIs for extended period. Monitoring kidney function and magnesium levels can help prevent complications. Additionally, adopting lifestyle changes to manage stomach issues effectively without relying on PPIs long-term can be beneficial. ACE inhibitors. Are you or a loved one using blood pressure-lowering medications like lisinopril, enalapril, or captopril? These belong to the class of angiotensin-converting enzyme inhibitors, or ACE inhibitors, widely prescribed for treating high blood pressure, heart failure, and diabetic kidney disease. While these medications are highly beneficial, if not monitored regularly, they can cause severe kidney damage without you even realizing it. ACE is a double-edged sword, protecting the heart and kidneys. First and foremost, it must be emphasized that ACE inhibitors are among the most important drugs in modern medicine. They work by inhibiting the enzyme that converts angiotensin I into angiotensin II, a substance that constricts blood vessels and retains salt and water. By blocking this enzyme, blood vessels dilate, blood pressure drop, and the heart does not have to work too hard. This helps protect patients from heart failure, heart attacks, and kidney damage caused by diabetes. However, the very mechanism that protects the heart and reduces blood pressure can also pose a risk to the kidneys if the patient is not closely monitored. How ACEs can turn into a double-edged sword for the kidneys. Normally, angiotensin II helps maintain the filtration pressure in the kidneys, especially in situations where blood pressure is low or blood flow to the kidneys is reduced. By inhibiting this mechanism, ACEs can significantly lower the filtration pressure, causing a sudden drop in kidney function, which is known as drug-induced acute kidney injury, AKI. This is more likely to happen in the following conditions: dehydration, which can be caused by diarrhea, high fever, or poor intake of food and fluids. The use of NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, which can stress the kidneys, and high-dose diuretic use water pills, which can also place additional strain on kidney function. The combination of ACE inhibitors, ACEs, NSAIDs, and diuretics is often referred to by doctors as the triple threat to the kidneys, as it significantly increases the risk of kidney damage. This combination can lead to acute kidney injury due to their combined effects on fluid balance, blood pressure, and kidney filtration. If not detected early, this situation can cause increased creatinine levels, decreased glomerular filtration rate, GFR, and ultimately lead to acute kidney failure. Another side effect to watch for: hyperkalemia, high potassium. ACE inhibitors reduce the secretion of aldosterone, a hormone that helps the body excrete potassium through urine. As a result, potassium levels in the blood can rise significantly, leading to hyperkalemia, which can cause arrhythmias, possibly resulting in cardiac arrest if severe. Other symptoms include muscle cramps, fatigue, and a general feeling of weakness, as well as numbness or tingling in the hands and feet, and abnormal heart rhythms. This is why doctors always recommend regular blood tests to monitor potassium levels when you're on ACE inhibitors. Expert advice on using ACIs safely to protect your kidney. To use ACE inhibitors safely, it's important to regularly monitor kidney function and potassium levels, especially if you are taking ACE inhibitors long-term. It's also crucial to avoid dehydration by maintaining adequate fluid intake and avoiding situations that could lead to dehydration, such as during fever or diarrhea. If you are using NSAIDs, diuretic, or other medications, consult your doctor, as their combination with ACE inhibitors can increase the risk of kidney damage. 6. Antiviral medication. In an era where chronic conditions like HIV, hepatitis B, or herpes infections are increasingly common, antiviral medications have become life-saving for millions. However, a little-known fact is that many antiviral drugs can cause kidney damage silently and severely. Tenofovir, a trusted hero, but the kidneys need protection. Tenofovir is one of the most widely used drugs for treating HIV and hepatitis B. It works by preventing the virus from replicating, reducing viral load in the blood, and extending the patient's life. However, prolonged use of tenofovir can damage the proximal renal tubular cells, the part of the kidney responsible for reabsorbing essential nutrients and electrolytes from urine. When this damage occurs, the patient may develop Fanconi syndrome, a rare but serious condition where the body loses phosphate, glucose, potassium, bicarbonate, and other electrolytes through urine. Consequences of Fanconi syndrome. Fanconi syndrome can lead to several serious complications. These include osteoporosis, where bones become brittle and more prone to fractures due to phosphate deficiency. Individuals may also experience muscle weakness, fatigue, loss of appetite, and weight loss.
Many people
if
over
left
60
undiagnosed
begin to
or
feel the
untreated,
slowness in every
Fanconi
step,
syndrome can cause
even
chronic
though
kidney
they
damage
maintain a
and may
positive
even lead to
lifestyle
irreversible
and believe
kidney
they
failure.
are taking care of their bodies.
Acyclovir,
They still
easy to
face
use but
symptoms
risky
like
without
aching
sufficient
liver.
hydration.
Many people over 60
Acyclovir,
begin to feel the
commonly
slowness
used to treat
in every
herpes
step,
simplex,
even
shingle,
though they maintain a
and other
positive
herpes virus
lifestyle
infections,
and believe they are taking
is
care
generally
of their
considered
bodies.
safe.
They still
However,
face symptoms like
it can
aching
crystallize in
ileum.
the kidneys
Many
if not
people
taken
over
with
60
sufficient
begin
water,
to feel the
leading to
slowness
urinary
in
tract
every
obstruction
step.
and acute kidney
Even
damage.
though they maintain a
This issue
positive
is not
lifestyle
caused by the
and
dose
believe they are
itself, but by
taking care of their
dehydration,
bodies, they
which is
still face
particularly
symptoms
dangerous
like
for older
aching
adults or
ileum.
those who are
Many
sick
people
or have
over
a high
60
fever.
begin to feel the
Warning
slowness
signs of
in
a
every step.
cyclovir-induced kidney issue.
Even though they
The
maintain
warning
a
signs of
positive
kidney damage
lifestyle
due to a
and
cyclovir
believe they
use
are taking
include
care of
pain
their
in the lower
bodies,
back or
they
lumbar
still
region,
face symptoms like
decreased
aching
urination,
ileum. Many people
and
over
dark-colored
60
urine.
begin to feel the
If kidney
slowness
function is
in every
significantly
step.
affected,
Even
symptoms
though they
like
maintain a
fatigue,
positive
nausea,
lifestyle and
and
believe
swelling
they are
of the
taking
hands
care
and
of their
feet
bodies,
may also appear.
they still face symptoms
It is crucial
like
to stay
aching
well
ileum.
hydrated
Many
while
people
using a
over
cyclovar
60
to
begin
avoid these
to feel the
complications.
slowness in every
The
step.
silent kidney,
Even
always
though
listening,
they maintain
but
a
never
positive
speaking.
lifestyle and
The
believe
danger
they are
lies in the
taking care
fact
of
that
their
kidneys are
bodies,
highly
they
resilient
still face
and often do
symptoms
not
like
show clear
aching ileum.
symptoms
Many
until
people
significant
over
damage
60
has already
begin to
occurred.
feel the slowness
This is why
in
taking
every step.
antiviral medications,
Even though they
whether it's
maintain a
tenofovir,
positive lifestyle
a cyclovir,
and believe they are taking
or
care
other
of their
drugs like
bodies, they
lamivudine or
still face
valacyclovir,
symptoms like
require
aching
strict
ileum.
medical
Many
supervision.
people over 60
Advice
begin
for those
to feel
taking
the slowness
antiviral
in every
medications.
step.
For
Even
individuals
though
on
they
antiviral
maintain a
medication,
positive lifestyle
it is crucial
and
to have
believe they
regular
are
kidney
taking care
function
of their
tests,
bodies, they still
particularly
face
to measure
symptoms like
creatinine,
aching ileum.
glomerular
Many people
filtration
over
rate
60
GFR,
begin to feel the slowness
phosphate,
in every step.
potassium, and
Even
urinary
though they
glucose.
maintain a positive
Staying
lifestyle
well hydrated
and
throughout the
believe they
course
are
of
taking
treatment
care of
is
their
also
bodies,
essential,
they still face
especially with
symptoms
medications like
aching
a
ileum.
cyclovir.
Many people
Aim
over
to drink
60
at least 2
begin
liters
to
of
feel
water
the
per day,
slowness
unless
in
your
every
doctor
step.
advises otherwise due to
Even though
medical
they
conditions.
maintain a positive
Be
lifestyle
vigilant for unusual
and believe they
symptoms,
are taking care of
including
their
fatigue,
bodies, they
muscle
still
cramps,
face symptoms
reduced
like
urination,
aching ileum.
dark-colored
Many people
urine,
over 60
or
begin to
changes
feel
in
the
joints,
slowness in
as
every
these could
step.
signal kidney problems.
Even though they maintain
It is
a
also
positive
important
lifestyle
not to
and
increase the
believe they are
dose
taking care
or
of their
extend the
bodies,
duration of
they
treatment
still face
without
symptoms
consulting
like
your doctor.
aching ileum.
Additionally, inform your healthcare provider if you're taking multiple medications simultaneously. The risk of drug interactions or increased kidney toxicity is a real concern, and your doctor can help manage these risks effectively. 7. Chemotherapy drug. Chemotherapy is one of the most powerful weapons modern medicine has in the fight against cancer, slowing disease progression and extending life. However, the price can be steep, and the kidneys are one of the organs most affected. Cisplatin, a destroyer of both cancer cells and kidney cells. Cisplatin is a highly effective chemotherapy drug used for treating cancers such as lung, ovarian, testicular, and bladder cancer. However, it is also one of the most nephrotoxic kidney-damaging drugs used clinically. The mechanism of kidney damage caused by cisplatin involves direct accumulation in renal tubular cell, causing inflammation, cell necrosis, electrolyte imbalances, and, ultimately, acute kidney failure if not properly managed. Typical consequences of cisplatin toxicity. Cisplatin, a chemotherapy drug, is effective but can lead to kidney toxicity. The typical consequences of cisplatin toxicity include increased creatinine levels and decreased glomerular filtration rate, GFR, which indicates impaired kidney function. Electrolyte imbalances, particularly with potassium, magnesium, and sodium, can occur, leading to serious conditions such as arrhythmias, muscle weakness, or fainting. Other symptoms include reduced urination, fatigue, loss of appetite, and swelling. Methotrexate, necessary but can cause kidney obstruction. Methotrexate is commonly used to treat blood cancers, head and neck cancers, and autoimmune diseases like rheumatoid arthritis. However, when methotrexate blood levels are too high, especially during cancer treatment doses, it can crystallize in the kidneys. This crystallization can cause a blockage of the renal tubules, interstitial nephritis, and acute kidney failure. If methotrexate is not quickly eliminated from the body, it can lead to systemic toxicity, affecting the liver, bone marrow, and central nervous system. How to protect the kidneys during chemotherapy. Kidney damage caused by chemotherapy can be minimized with proper management. Strict adherence to treatment protocols, including fluid management, electrolyte monitoring, and close tracking of kidney function, is essential to protect the kidneys. What doctors do to protect the kidneys during chemotherapy. To protect the kidneys during chemotherapy, doctors typically administer pre- and post-treatment fluid infusions, often using saline, NaCl 0.9, sodium bicarbonate or alkaline urine solutions, creatinine, urea, EFR, and electrolytes are carefully monitored before, during, and after chemotherapy treatments. In some cases, chemotherapy doses are adjusted based on the current state of kidney function. Additionally, kidney protective drugs, such as amifostine, may be used in special cases to reduce the risk of kidney damage. By following these strategies, the risk to kidney health from chemotherapy drugs can be significantly reduced. Conclusion: protecting the kidneys, the key to long-lasting health. The kidneys cannot speak up when they are being damaged, but you can listen to your body. Symptoms like fatigue, swelling, low urine output, or changes in urine color are warning signs. But unfortunately, they often appear only when damage has reached a severe stage. Early detection is crucial to avoid long-term consequences. Remember, many seemingly harmless medications can silently harm the kidneys. They can lead to serious kidney function problems if not used properly and without proper medical supervision. Before using any medication for a long time, always check kidney function regularly. Do not self-medicate and always consult your doctor if you have any concern. Maintain a habit of drinking enough water, living healthily, and having regular health checkups. These are key to protecting your kidneys and preventing illness. Share this information with others to raise awareness and protect kidney health. If you have any questions, feel free to leave a comment, and I will respond right away. Taking care of your kidneys might seem like a small action, but it's a crucial step toward living a long and healthy life.